The World Health Organization has said that some countries and communities have fallen into a false sense of security that vaccines have ended the pandemic. Director General Dr. Tedros Adhanom Ghebreyesus is now advising the vaccinated to remain socially distant and continue wearing masks amid a surge in COVID cases in Europe. Take a look.
Last week, more than 60% of all reported cases and deaths from COVID-19 globally were once again in Europe. The sheer number of cases is translating to unsustainable pressure on health systems and exhausted health workers. In many countries and communities, we're concerned about a false sense of security that vaccines have ended the pandemic and that people who are vaccinated do not need to take any other precautions. Vaccines save lives, but they do not fully prevent transmission. Data suggests that before the arrival of the Delta variant, vaccines reduced transmission by about 60%. With Delta, that has dropped to about 40%. If you're vaccinated, you have a much lower risk of severe disease and death. But you're still at risk of being infected and of infecting others. We cannot say this clearly enough. Even if you're vaccinated, continue to take precautions to prevent becoming infected yourself and to infecting someone else who could die. That means wearing a mask, maintaining distance, avoiding crowds, and meeting others outside if you can, or in a well-ventilated space inside. And we continue to call on all governments to implement a comprehensive and tailored approach of public health and social measures to prevent transmission, take the pressure off health systems, and save lives. While Europe is again the epicenter of the pandemic, no country or region is out of the woods. It's important for all countries to surge their capacities now to ensure the right measures are in place to avert the worst consequences of any future wave.
The issue will eventually be less of a supply side issue, but really a prioritization issue, and making sure that we're solving the problem of finding the people who have no doses before we prioritize those who already have 2 doses. And remember, this is not a phenomenon just of low-income countries. Also, in much of of Europe, where we're seeing the current outbreak, much of that is being driven by the unvaccinated, of course, and many of the people ending up in ICUs who are dying are unvaccinated folks. So the first priority everywhere has got to be reaching the unvaccinated, most highly vulnerable populations. Eventually, we will need to get to boosters to sustain immunity. It looks more and more, but at this point, there's still an awful lot of unvaccinated people out there.